Good afternoon, everybody. This is Dr. Farnan and
Dr. Lanier
from Cutting Edge Foot and Ankle, and you're listening to another wonderful episode of MedNation Podcast, the show that involves two podiatrists having conversations with industry experts for people who love to learn about everything from head to toe.
Today, we invited Dr. T. Nguyen, DPM, to our podcast. Welcome to MedNation, Dr. Nguyen.
So, this is exciting. You called me an expert. Did I just hear that right?
Yeah.
I'm going to take it for a win today. Okay, go ahead.
I've been following Dr. Nguyen now on social media for some time now, and I love your content and your material, and I know that and your recent endeavors. You own a cash-only podiatry clinic there in Aptos, which is new, right? Aptos is your new location, is that correct?
Yeah.
Aptos is how you pronounce that too, right?
You know what? I'm not a local. I'm going to go for it. Aptos.
Yeah, that sounds good, right? So Dr. Nguyen, tell us a little bit about yourself. Tell our subscriber and audience a little bit about yourself.
All right. So I can be considered a natural Californian, although I wasn't born here. I was born in Utah, but raised in California. And I currently own my solo practice, Pacific Point Podiatry, in Santa Cruz County. And I cover two counties, Santa Cruz County and Monterey County. So that's the boring stuff that I do. The fun stuff that I do is I'm also a mom to a 4-year-old. And I also coach other podiatrists in creating their own dream practice without insurance headaches.
That's awesome. What inspired you to open a cash-only specialty clinic?
Sometimes when you're pushed up against the wall, you don't know what else to do, so you start getting creative. So I opened my practice in 2018 with insurance. So I did what everybody else was doing. I signed on to every possible insurance panel I could get my hands on. And I thought that was the right thing to do, not realizing that I was actually letting go of a lot of control. So I left it up to my biller to get all of the insurance credentialing process in line. And then suddenly I waited and waited to get paid. I had 2 full-time employees with benefits. I had an entire building to cover expenses for, and I was just starting. I had no idea what my income was going to look like. Sure enough, in no time, my bank account went under zero. I was overdrafting. And I was like, I see all this money sitting in the AR. What's happening? Why is it not coming the way I envisioned it would? Nobody really prepares us how to run a business in this way. Most people leave their training to either get employed or they are an associate to start with, and for me, I opened up because I didn't have a choice. There wasn't an employment option. I was pregnant. It didn't work out where I was previously working. So I really had to learn very scrappily, pick up the pieces and figure out how to do this. And then I saw how quickly money was leaving. It was leaving faster than it was coming in. And then I got tired of it after a year. I said, this projection was not going to sustain me for the next 15 or 20 years of my life. So I had to learn how to run a business like a business. And the most financially feasible way to do that was to opt out of the insurance game.
So I can relate in that aspect. I opened my clinic in 2019 on my own. I had a support system. My husband is a physician. He has that income. So I felt like I could do it, even if we have to struggle on my side, on my income. And that's what I felt. The first year, 9 months into it, I was not making anything, and I have to, to pay for everything else to run the clinic. But I think a year after is when I felt like the AR was coming down, insurance were, I started getting paid. 3 years later, now we have 5 locations, 5 providers. Do you think if you had waited out a little bit, would it make a difference for you?
For me, well, the fact that I had to wait for permission to help my patients get their MRI or to get a surgery to be paid or to get prior auth on basic medications, I don't think I would have changed. Even if I made more money, even if I doubled my income or my revenue, I think working under the guise of an insurance-based practice meant you gave up a lot of your autonomy as a doctor
Mhm.
on what you can and cannot do for patients. And I didn't like that at all because I felt that I was way more efficient than the system allowed me to be. I can heal diabetic foot ulcers than traditional means. I can invest in myself to do more innovative surgeries than the system would allow because there's no CPT code for MIS in the office. So I just really didn't like being controlled. And by working a lot for very little, my creative energy was consumed in learning a billing code. And I didn't feel that's where I wanted to spend my energy. I wanted to have the creative ability to problem solve for my patients efficiently and effectively. So there's just no way I could have done that in the insurance-based model.
No, I definitely applaud you. That is like a brave move on your
It
part.
is. It's absolutely inspiring. Can you talk about your patient population? Me and Dr. Lanier have talked about possibly, that just tinkering with the idea of just a direct to patient care, but it requires a particular patient population, right? And let's talk about your patient population and how amenable they are to those treatments. Because a lot of these folks, I can imagine, and you could probably refute this, is they pay into Medicare, they pay into these big insurance companies, and they come to you and they're like, look, I'm on Medicare. I'm on the best Blue Cross Blue Shield, if that's, that doesn't even exist. But, you know, and you're like, well, like you said, I mean, you can actually obtain better care going through your methods. I mean, talk to me about, your patient population.
I don't know how to describe my patient population because I see people of all income levels, of all different insurances. I see people who are uninsured, and I see very wealthy people who won't pay a penny into their medical care. So I think the most generalized way to look at it is I'm seeing people who want to be seen, who are willing to pay out of pocket for expert medical care. I mean, and that comes at a varied amount of income levels. So I don't think that we can say direct care is only for ...
Right.
because it's really accessible care for everyone. People who had insurance, lost insurance, they're in between jobs, or they have high deductibles. These are all barriers to medical care because people think you need insurance to see a specialist. Whereas I'm actually removing that barrier and saying, if you want immediate access and you want to talk to me directly rather than a phone tree or going through, person after person before getting to me, then that's what you pay for. You pay for convenience. So these are people who are paying for that convenience factor, that personalized care. And you can compare that to, why do people utilize urgent care center? Well, they're going there because they can't access their primary care doctor, or they don't really know what to do. So they just go straight to what's open 24/7. Whereas now I have the opportunity to educate my patients and say, if you step on a thumbtack, if you twisted an ankle and think you fractured it, if you have an ingrown toenail that looks infected and you think you need an antibiotic, call me first. Let me evaluate and help you decide on whether or not you need to go to urgent care or not. So I am a lot more accessible, and people really like that personalization. And the bar is so low as to what patients really want that you just spend another 5 minutes with them, they'll pay for that.
Well said. Yeah.
I think that's great points. Accessible is great and it's needed. I'm sure patients appreciate that, and I like to go to my primary care physician, and I like her to be accessible, and that's probably what patients want from us podiatrists.
Let's talk about your memberships. Okay, so what services you offer with your membership, and let's start with that.
I have two models. So the membership is preventive foot care. That's a pain in the ass to have our insurance to pay for, right? Because
Right.
now we're like having to pick which modifier for what problem, and we're having to ask PCP for their chart notes on to justify their diagnosis. And it's like, why are we playing this game? So that is what the membership is for. It's for long-term patients who just need foot care. And that is a very basic fee of $125 a month. It's like having access to the gym. So if you
Mhm.
need it, great. You already paid for it. If you need additional stuff, it's easy. We're not going to penny pinch and nickel and dime you for everything. It's all included. What's all included in that is ingrown toenail. Because like when you trim a nail and you miss the spicule, you might call it an ingrown. You just don't know sometimes. And so that's kind of all included in their peace of mind foot care. If they sprain an ankle and they just need a quick workup, like an x-ray, that's included. If they need a steroid injection for plantar fasciitis, easy, all included. So I created a package that was intended to just give them peace of mind that I am the podiatrist that has their health interests at hand, and I will do my best. If I can take care of the problem within 15 minutes or less, it's included. I'm not going to sit here and be fickle about, I did an injection with a Kenalog versus the lidocaine. Is that $1 or is that $2? I'm not going to sit here and play math. I'm just going to say it's all included, and you can breathe. You can relax and know that I'm trying my best to take care of you.
So you said 125 a month. That's great.
Mhm.
So they can call in for any acute problems within that month, and it's covered.
Yep. So like 125 might be expensive to somebody. It might be really cheap to somebody. So it just really, it's a matter of perspective, right? Like, would you pay
Right.
125 for, I don't know, an iPhone? That sounds like it's really cheap. And so it's relative. Like for us here in California, gas prices is $7 a gallon, and that sucks. But to us, when it goes down to $6, we're like, oh, hey, it's all of a sudden affordable, right? So it's all relative.
No, if it's working for you, it's great. I mean, that's what we wanted to learn. We want to learn the business that is working for a lot of people, and we don't have to deal with insurance companies. So this is great.
And then, so that would be your first model. And then you said you had a second model?
So fee for service for more episodic things where maybe it can just be managed once or twice. The office visits, and our office visit is $450, and then the follow-ups are $175.
Got it. Yeah, it's absolutely reasonable for your time.
And it's going to go up. So inflation goes up, our prices should go up, but instead insurances are wiping it down. Seems kind of silly, don't you think?
Agreed.
So the 450, does that include if you have to dispense DME, or do you charge extra for that too?
If they need DME, I work with them. If they want to use their insurance, it's not a big deal. I work with the local pharmacies. If they want it conveniently in my office, then I charge them whatever I pay for it plus a little margin for the convenience. So I don't try to make a killing off of the things that I sell. I'd much rather spend more time with the patients and they can pay for my time. Kind of like a lawyer, it is what it is.
Yeah, no, it's a great model to have. What about, so are you able to see a lot of patients during the day if you have to book an hour patient? So probably 8 to 10 patients a day.
Why would I want to see a lot of patients? What would that do for me?
That is true. So what, how many patients do you see a day? That's great.
So that's a trick question, right? Because when people go into direct care, that is the exact same questions. How many patients do you see in a day? Because we are so driven by numbers, we are so driven by volume. That's how we gauge our progress from day to day. Did you see a lot of patients? Did you see a little, how did you see few? So one patient can cover a full day of schedule in the cash model. So for instance, if I'm doing a surgery that I charge $5,000 and that's all I want to make that day, then it's just one patient. Or if I'm doing injectables, I charge $1,000 to $2,000 for that. I just need to see a couple of those. If it's all clinic, then maybe at most I can spread myself to 12 people, and that's actually really exhausting. I try not to do that because I am starting to treat my practice as a side gig. I don't want to be in my office all day, 5 days a week. That's not who I am.
That's starting to sound like Dr. TJ on. I know that conversation well. Someone knows Dr. TJ pretty well, don't you?
I don't actually.
Really?
I know what I want. And I want to control my time. And the only way you can gain time back is if you really evaluate how you're spending it. If you're spending your one time with the one patient for $60, you're going to have to see a lot of patients. And it doesn't even cover our malpractice, our insurance, our liability, the risk of audits, the risk of litigation. That $60 does not do a whole lot for us, especially if we have staff as well. So we have to really reevaluate what we're putting in, the risk that we're taking on, and what we get out of it. And that $60, you know what? My neighbors can take it. There's a ton of podiatrists here. I'm not fighting for that $60 patient at all. They can have it.
Yeah, I saw 36 patients today, and I'm feeling sad about it right now. I could have seen 5 cash pay patients if we design our clinic to that model, David.
I know. I would have made this week already done with my vacation included. Just seen today. Dr. Nguyen, I'm exhausted.
You should write a book. We have to.
Like it's just knowing that there's another model. You can start thinking about what you can do next. The next move is really to evaluate your insurance panel, because there's no way that we as an individual or even a 2-person team can leverage more. The house will always win. The house may give you what you want in the beginning. They're going to find a way to get it back. So it's not a game that we can win at. And if you want to keep playing with it, cool, you have the energy. I don't. I do not have the patience or tolerance for a game that is not meant to be won.
Well said. So let's talk. I was going to say, let's talk a little bit about you, including what do you see as some of your long-term goals with your membership plans and with your clinic, and are you thinking about opening and operating more clinics in the future?
That's a really good question, because I kind of toggled between what my future clinic looks like. I love the pace that I'm at. I love that it's a much more intimate feeling. I'm very well invested in my community, in knowing that they have options and just quick access to care, because my community is very heavily influenced by corporations. And it's really sad to see when, I look on these Facebook forums and people complain about doctors not realizing what we are having to deal with. And so they blame us for our tardiness, or, not being seen on time, or their insurance didn't approve whatever problem they had. And so I see myself kind of helping more doctors start up their own practice this way, their way. So maybe they want to do less of what I do, like palliative care, but they want to do more sports medicine. And this is a design that people can figure out on their own what works for them. But really, it's offering other doctors an option. And I really want to be able to not create more clinics for myself, but help other doctors do it for themselves. So that's my long-term vision, is that I have, the model in place, and then I just give people the blueprint, and then you can go have at it and decide how you want to design it.
I'm sure after listening to this episode, you might have a lot of takers.
Well, I have to share. It's dreamy on this side, but don't be fooled to thinking that it's easy.
Right.
And I think you're gonna encounter a lot of consultants and coaches who make it sound really easy. And I feel like you should go in well prepared. You should know that it's hard. It's like going into podiatry school. You know it's going to be hard. You know that there's going to be times you're going to need more help. And direct care is the same thing, because you're going to be starting a new business model with a new set of eyes. And so the question about how many patients you see in a day is a little bit less relevant. It's really, what quality care do you want to provide? And what solutions do you have to offer?
That's true. Are you, let's talk a little bit about the virtual medical assistant. We hired some now, and we are using a medical assistant and front desk from somewhere in Philippines. And I know we have used a medical assistant before. How's that working out for you?
I had a virtual assistant when I was still in the insurance-based model, because you might know, being on the phone 40 minutes at a time, it's not worth anybody's time. So when I was insurance bounded, I needed a virtual assistant to do insurance verifications, understanding what to collect if they didn't meet their deductible, what their co-insurance is doing, and so on. And so this was a whole nother language I was unwilling to learn, but had to learn accidentally, because billers weren't catching a lot of the money that was slipping out of our hands. So I got the virtual assistant for that. And then when I started to opt out more aggressively out of insurance, I didn't need them much anymore. And so I just have right now one part-time medical assistant in the office, and I utilize a virtual assistant for other admin tasks like marketing, social media marketing, and so on.
And what is their role in your social media marketing that you hire? Because I know they're virtual, obviously. How do they help in that respect? Because I mean, I feel like a lot of social media marketing. I mean, of course, they can create Canva designs and such and educational material, but I've seen your content. It's impressive, and I always appreciate good content. And so, how do they help you in that regards?
Oh, thanks so much. So I've gone through a couple of virtual assistants for my marketing, my social media marketing, and I've had some stuff that was good, but it wasn't good enough. Like it wasn't my tone. So what you see now is me, because now I have time. I'm not seeing 30 people a day, but what you see is me currently. And what I have done in the past with a virtual assistant is that I've had them design the post with my colors and things that I want to promote.
Right.
But I didn't love the tone. Like you can tell that it wasn't me speaking in the post.
Right.
So I hated that. And I was like, I don't want to come off as somebody who's salesy, who is just being really generic and just trying to gain followers. I really wanted to educate and connect. And so I had to revamp and reevaluate what I wanted to do for my social media. And so I'm in a transition right now, but I'm still looking for another virtual assistant who can take over the creative design, because it takes time. Even though it's easy to do on Canva, it takes our brain energy to do that. And if we're doing that at our physician rate of $500 an hour, creating one social media post on Canva, we just paid out $500 for a post that may not convert. So it's better in interest in our time to spend, a VA that may be $5 or $10 an hour to generate all of your posts ahead of time, and you review it, and then you have them set the calendar, and it just goes. So I've done that in the past, and I'm looking to do that again in the future.
That is awesome. Well, Dr. Nguyen, thank you so much for all that wealth of knowledge. My brain is exploding now. I'm going to read it. I'm following you more. We appreciate you taking your time, to talk with us and educate us.
Yes, truly appreciative, and you left some good insight to the listeners as well as us, and we really appreciate that.
I am so happy to connect with you because I don't think enough doctors know they have a choice. Most of us come out thinking the insurance way is the only way. And there's like well over 40,000 doctors doing direct care or concierge care or cash practice of some variety. They're just less dependent on insurance reimbursement. And I hate to say it, but we are way happier on this side.
Sounds like it.
I'd love to hear that. And just a quick question, something fun beyond just work and patients and foot and ankle care. What do you have a book recommendation that you're currently reading right now that you want to share?
Oh my God, I have a whole laundry list of books. Hold on, let me pull up my book of stuff.
Are you reading Recourses book club right now?
I'm not in a book club, but I would love to be part of one. So the one that I had going on today is called Who, Not How by Dan Sullivan. And I love this book because you have to get it, because it talks about not asking the question of how to do something, but who can do it for you.
Yeah.
So that you're not wasting your own brain energy on an area that's really not your area of expertise. So don't waste brain energy on learning a thing that you really don't have interest in doing. Let somebody else who wants to do it and is good at it do it. So that's a fun one.
Oh, Dr. Lanier, we need to read that one.
Oh yes, I'm going to order that for us.
I feel that's your My Life 101.
I'll order them today for us.
Yeah, and it'll really make you kind of reevaluate how you're spending your time. Because if you're spending an hour on a Canva post, you just lost $500. Can you just hand that off to somebody who you can charge $10 for? Like, come on.
Yeah, we can relate with you on that aspect, because Dr. Farnan and myself, we have families as well. We have kids, and we like to be at home with our kids a little bit more,
Yeah, I am all for that. If you want a balanced life, direct care is going to give you that for sure.
Well, great. So thank you again. And thank you, everybody, for listening to another wonderful episode of MedNation Podcast with your host, Dr. Fawn and Ann.
Dr. Lanier.
We hope you enjoyed our wonderful conversation with Dr. Nguyen. If you want to hear more conversations like this, join us for our next episode. As always, you can head over to the Apple Podcasts and Spotify to hear more episodes like this. If you have any questions for Dr. Nguyen and or us, check out the links also in the description below, and feel free to email us and connect. Thanks. That's all for this week's episode. Thank you guys, and see you guys next time.
See you next time.
Bye.
Bye.